It sounds like what you're saying is that the model from the industry perspective is to create repeat customers, which there is a benefit to keeping people sick and dependent.
Yeah, absolutely. And all these new drugs are marketed as being non-dependence inducing in comparison to the previous generation of drugs. So when the SSRIs came along, they were said to be, they're not addictive, don't worry about them, people can get off them easily, in comparison to the benzodiazepines, which had previously thought to be non-addictive, but shown to have, caused significant withdrawal problems. And, it's now perfectly clear that antidepressants make people physically dependent and can give people really nasty withdrawal symptoms, which in some cases can go on for months and years after people have stopped taking the drug.
I could talk to you for hours, but I want to be respectful of your time. So one final question, and I think it's an important one. I'm curious to know about what you believe the future of psychiatry is as a viable healthcare medical profession that serves the public. What do you think shifts need to take place, and what could you envision it in 20 years, 30 years, where it really does return to its roots and, psychiatrists are healers?
So a couple of points. I think that the vast majority of what we call mental health problems need to be moved completely out of medicine, and probably located help for people who have those mental health problems. And as I say, I'm not advocating that we shouldn't help people, but help should be located, I think, primarily in social services, so that people can focus on the reasons why they are unhappy or stressed or anxious, whether that's debt problems, relationship problems, employment problems, whatever, rather than turning up in a doctor's office where there is an implicit medical framework, even if the doctor does their best to try and challenge that. The minute you walk in the door and there's a stethoscope sitting on the table, you are in an environment which screams at you, there's something wrong with your brain, with your physical body. So I think that needs to be done. Now, there are some people who get into a really severely disordered mental state. Sometimes we call that psychosis or mania, psychotic depression. There are all these, diagnostic labels that we can apply to these extreme states. And those people, some of those people at least, will need looking after, keeping safe, and sometimes the community needs to be kept safe from them when they're in a really bad state. And someone needs to do that job. And that job sometimes involves giving people psychiatric medication. I think that when people are acutely psychotic, antipsychotics can be useful for some people. They don't target the psychosis, they don't cure anything, but they can numb people, sedate people, make people less preoccupied with all the psychotic stuff that's going on in their brain. So those are the things that need to be done. We need to be helping the vast majority of people in social services to deal with the problems in their lives that are leading them to struggle. And we need to help people with more extreme mental states by keeping them safe and secure, and sometimes intervening with drug treatments that may calm them down and help reduce the intensity of their experiences and the extremity of their behaviour. Now, who does that is, I think, an open question. And whether the people that are doing that need the sort of training that psychiatrists currently have is another interesting question to debate. I think the people who are doing that do certainly need some training in biology and pharmacology. If you're going to give people drugs at all, you need to understand what you're doing. And actually, you need to have a much better knowledge of drugs than we currently have. Currently, psychiatrists' knowledge of drugs is woeful. It's terrible, because all the research is just focusing on this idea that the drugs are tweaking some underlying problem without paying attention to all the ways in which these drugs are altering the normal state of the body and the brain and all the effects that that has. So whoever it is who's using these drugs needs to be much better educated about the effects of the drugs than people are currently. Whether you call them psychiatrists or not, I don't know. But that's what I think that needs to be done.